Okay, so now we're in the second part of our Rickettsia, Coxiella, and Bartonella lecture. And in this lecture, we're going to focus on the next group of rickettsial organisms, and that's the typhus group. So the next organism in the Rickettsiaceae family is Rickettsia typhi, and Rickettsia typhi is the causative agent of the disease endemic or murine typhus. Now, the natural reservoir for Rickettsia typhi is the urban rodent, and transmission occurs through the rat flea. So we now have another vector. We've had the louse, and we've had the mite, and we've had the tick. So now we have a rat flea. Bacteria from Rickettsia typhi, the bacteria Rickettsia typhi from the flea are released into the gut lumen of the flea. So what happens is when individuals are bitten by infected fleas, it causes them to get itchy and they scratch. And what happens is the bacteria get defecated out of the flea from the gut lumen as the flea is taking a blood meal, and you scratch that defecated material containing the bacteria right into the bite site. So that's how individuals get infected with Rickettsia typhi. There are 40 to 60 cases of endemic typhus reported per year in the United States, and it's much more common in southern Texas and California. Now, endemic typhus doesn't always produce a rash. So here's a close-up of the rat fleas, and this is a very magnified picture. If any of you have had animals and maybe pulled the flea off of one of them, fleas are usually about the size of the head of a pin. Now, another rickettsial organism, Rickettsia prowazekii, is the causative agent of the disease epidemic typhus. Now, epidemic typhus is also known as louse-borne typhus. It's transmitted by the body louse, by a squirrel louse, and it's more common under unfavorable conditions such as war, famine, and any type of social upheaval, where you have a lot of individuals, crowded conditions, malnutrition. So what happens is the infected louse again will defecate while it's taking a blood meal, and then the Rickettsia prowazekii is rubbed into the bite area and scratched in, and that's how it gets inside the body. So epidemic typhus has a 10 to 60% mortality rate, and the mortality rate increases with age. Here is a close-up of a body louse, and here's a close-up of a head louse. Now, there's something called Brill's disease or Brill-Zinsser disease, and this is a relapse or recrudescence of louse-borne typhus. So it occurs many years after the initial disease. Now, the relapse is usually a milder and shorter and less debilitating symptoms than the primary infection. So what happens is individuals get infected with louse-borne typhus, they overcome the infection, and many years later that rickettsia has been sitting latent in the body, and what happens is it then decides years later for various reasons to recrudesce, come back, and generate symptoms. So now these latently infected individuals now become a reservoir for the organism and for transmission of infection, because then these individuals can have lice that take a blood meal. The lice will then pick up the rickettsia and then can go transmit the rickettsia to other individuals. Another organism, the Orientia tsutsugamushi, is the cause of scrub typhus, and the vector in this case is the mite, or what's also called the chigger, and the main reservoir is the rat. Now, the incubation period of scrub typhus is 2 weeks, and in scrub typhus, you get the tache noir, those little black spots that will form at the site of inoculation. So the rash in scrub typhus starts on the trunk. So it's different than some of the spotted fevers that tend to start on the extremities and move to the trunk. In scrub typhus, it starts on the trunk and then spreads to the extremities. And the rash does not involve the palms of the hands, the soles of the feet, or the face. So, with all of these rickettsial organisms, it's very important for you to know, first of all, which organism causes which disease, what the transmitting agent is, so what the vector for each disease is, and also the differences among the rashes among each disease. So, like all the other rickettsial and rickettsial-like organisms, scrub typhus causes flu-like symptoms, your fever, your muscle aches, your headache. Now, the laboratory diagnosis of rickettsial infection is very different from all of the organisms we've discussed to date. So, you can look at these organisms under the microscope. We said earlier that they are gram-negative tiny rods or coccobacilli. However, these are not organisms that you can grow in artificial media and pick a colony off of a plate and make a gram stain and look under the microscope. These are organisms that have to be growing inside cells. So usually gram staining is not going to be done to identify rickettsial organisms. They stain very poorly with gram stain, so they usually are going to be stained with tissue stain, such as a Giemsa stain. Now, normally, how these organisms are diagnosed are through serological based testing. So, usually, an antibody test is going to be done with these. So, you can look for these organisms in infected cells or tissues using either your Giemsa stain or, more commonly, fluorescent antibody staining. So here you have immunofluorescent staining of Rickettsia, and you could see the tiny little gram-negative rods, although you can't tell they're gram-negative. In this fluorescent antibody stain, you could just see the small rods are fluorescing under a fluorescent microscope an apple green color. And the color of the fluorescence is going to depend on what type of fluorescent stain you use. Now here would be a Giemsa stain of Rickettsia rickettsii, and you could see all of the tiny little rods inside the cytoplasm of white blood cells. And again, a tissue staining. This is immunohistochemistry staining, and this you could see the organisms in the tissues. Again, you see a ton of little tiny gram-negative rods that are associated with white blood cells. So just things to remember, again, these organisms require cells for growth. You will not grow these organisms in your typical broth or agar artificial media that you would normally use in the microbiology laboratory. They require cell or tissue culture, they require a live animal, or they require embryonated eggs to propagate these organisms. Now, cell culture is not performed in most clinical diagnostic microbiology laboratories. Cell culture is not very difficult to do, but it does require some specialized techniques. So you will do cell culture more commonly in research laboratories, but there are some clinical microbiology laboratories that do have a virology lab that will grow some viruses. Usually they're not going to be growing rickettsia. But you may find yourself working in a research lab where you would do some cell culture, or in a diagnostic lab where you would do cell culture for one or two different viruses, but it is not common in a clinical laboratory. Usually in the clinical laboratory, what you will do is get a blood sample and do your serological based testing. So it's best to obtain a blood sample to identify rickettsia disease when an individual is having symptoms. So during that febrile period, when they're having a fever, there's more likely to be organisms disseminated through the bloodstream when an individual is in a febrile period. So serologically, you should show a fourfold rise in titer in an individual that is infected with rickettsia. And how the serological based tests are done is using antigens that are derived from chick embryos that have been infected with rickettsia. So you use these chick embryo rickettsial antigens to cross react with antibodies in patient serum. So the most common serological test to look for rickettsia, and we will mention this test with some other organisms, and this is the wheel Felix test. So what this test does is it uses X strains of Proteus vulgaris. So you get cross reaction of rickettsial antibodies with O antigens from the Proteus vulgaris X strains. So it allows a presumptive diagnosis of both your typhus and your spotted fever group organisms. However, be aware that you can get false positives in individuals that have Proteus infections, as well as individuals that have a Borrelia infection. And we're going to be talking about Borrelia in the next lecture. So this is just another schematic of the tick life cycle and a picture of a tick. So you have your adult female tick that's going to lay eggs. Those eggs will hatch into larvae. Those larvae need to mature and they need to feed, and their food source is blood, so they feed on small mammals. They mature into nymphs. The nymph immature ticks will again take blood meals from small and medium-sized mammals, and these nymphs will mature into either male or female ticks, and then the life cycle continues. So when you have an infected female tick with a rickettsial organism, that transovarian passage generates that infected life cycle of these ticks. So we're now going to move on to the third part of this lecture.